Hi there, my name's Dr. Michaela Fallon. I am a recently graduated resident of the Swedish Cherry Hill Rural Training Track in Port Angeles, Washington, and I'm here with the illustrious Dr. Rob Epstein. Hi, Rob.
Hi, I'm Rob Epstein. I'm the founding program director of the Rural Training Program here in Port Angeles.
Well, we can start with, an easy question. What do you think makes our program so special?
I've always thought that the people is what makes our program special. And I mean, the faculty and the attendings and our residents and our community, there's so many things that make our program special. I've been in Port Angeles since about 2000, and so for quite a while. And I've always thought that this would be a great community to train residents. It has this really interesting blend of it being not too big and not too small. Our clinical volumes are good. We've got a group of specialists like general surgeons and OBGYNs and urologists and pulmonologists and GI docs and so forth that actually like training family doctors. And then we've got family doctors that just still do everything. We're in the hospital, we're in the operating room, we're in the clinic, we're doing procedures in the office, we're doing procedures at the clinic. Some of us, work here in Port Angeles. We also go out to Forks, which is a much smaller community and a critical access hospital there. And so you've got this just real abundance of varied experience. So that's what I think makes our program special.
That's wonderful. Now, is there something, or has the program changed in some way over the past, 6 years that you feel particularly proud of? Any areas that it's grown in that you feel applicants should really know about?
Well, I think what's happened with our program is it's matured, and I think that that's more at the community level than the program itself. I think the community now is really used to having residents. I mean, you go at our clinic, and if there's not a med student or a resident that sees the patient in our side of the clinic, they're like, well, where's the med student, or where's the resident? And we've got the nurses at the hospital that just know that the residents are going to be involved. And so it's I think when a program is starting, there's this ramp up of time where you've got to have buy-in, not just by the faculty, but the buy-in at the hospital level of the nurses, of the other doctors that are there, that really have a positive feeling about the residents, and also this process of just teaching young doctors how things are done.
Yeah, and we feel it as residents too. I know that I can go to a specialist and that they're excited to facilitate my learning, whether or not they're expecting it that day. I can send them a message, and they're excited to create good family docs here.
And that's, in the reality, when I'm seeing patients, if I have a question and I text one of the general surgeons, or I text, the pulmonologist about a question, and I see the residents doing the same, that's good behavior. That's what I want to see. Or sending an epic message, or because that's actually better patient care for our patients.
Yeah. Well, knowing that you've worked with the residents for basically as long as we've been here, do you have any fun stories about things that you've learned with residents, or really memorable experiences?
Oh, there's been many.
I hope so.
Well, I think what's interesting is as all the residents are actually seeing patients that I've taken care of for a really long time, and it's been interesting to watch some of those interactions of that kind of we're delivering babies from babies that I've delivered, and that kind of family connection over time. And I really think that's another positive thing for the residents, to see family medicine in this context, where we're actually, as a clinic, we've taken care of these families for multiple generations. And so, we're seeing those families grow, those kids grow, start their own families. We're watching some of our older patients, go through their end of life issues, and it's all very real. And it's beautiful to watch. So.
Do you feel like you've learned things about the families you took care of from the
yeah.
residents interacting with them?
Yeah, for sure.
Yeah.
Yeah. I've been learning since I've come here about these families. So yeah, and the residents highlight different aspects of that.
I'm glad.
Yeah.
Now, you've been program director as long as this program has existed. You were instrumental in getting it off the ground. And now you're, phasing the process out. As you look back, how do you feel about, stepping down, and do you have any wise words for Dr. Waters as he steps into the role? I know you two are working quite close together, but.
Yeah, I think there's a lot of people have had some concerns about, me stepping away as program director and Dr. Waters coming in. And, to me, the succession planning aspect it's been fascinating. One part of it that we don't talk about very much is this, that we all sat down as faculty and we had all these big posters up on the wall with a bunch of Post-it notes. And of course, my poster that was me had like a zillion Post-it notes on it. And of all the different things that I did during the year, and that process of taking those Post-it notes and bringing it to somebody else's, or not, I didn't take those things, but people taking those things and saying, I will take responsibility for those things has been a really interesting process. And it's been really good. So I am slowly unloading the zillion different things that I do. And it's forced me to realize just all, how do I kind of keep track of all these things that I never really thought much about, but are actually very real. Things like, scheduling and how do we recruit new residents and that kind of thing. And spreading those responsibilities to other folks has actually been a really good experience. I am not going to just disappear the day that I step down. It's going to, again, be this transition, and I'll be there with Dr. Waters and all the rest of the faculty kind of still being present for at least another year or so after that, is our plan. So I don't, it's not like this sudden drop where the program director just stops and doesn't exist anymore. So it's going to be this process. And I can't tell people enough just how strong a faculty we've managed to put together. I always joke that I've tricked all these people to come work for us. But yeah, so I think it's going to be, I think we're fine. I really think that I don't really see things changing a lot because there's been a good, transference, so to speak. And you've got a mix of people on faculty or the attendings that do all the stuff, that do C-sections, that are in the hospital or in the ICU, that are taking care of babies and so forth. So, I think that procedurally and cognitively, we've got all sorts of good people there to do the same training that we've always done.
And I think it speaks volumes that, the residents are going to miss you being, an omnipresent person. But we're also excited about Dr. Waters. And it's been really amazing to watch this process go along as, a resident and now a coworker, both of how intentional the entire faculty is being and how excited everyone is.
Yeah.
So I think it speaks volumes.
No, I think it's gone really well, and my plan is that it will continue to go well. And I really think too that it's hard to see this, but on the backside, there's actually a ton of support that we get even away from the residency through the WWAMI Family Medicine Residency Network that I think Dr. Waters is really well connected into, as well as the rest of the faculty, that even that traditionally has really supported myself in a lot of this stuff, and it's getting everybody else in the region kind of knowing what's going on. Yeah. I've become one of the regional experts on succession planning.
We should make a TV show about it. I think there is one called Succession already, though, so we can't use that title.
Can't use that title. But it's been an interesting process because instead of just saying, okay, I'm going to stop, this has been this kind of gradual process. And I know that residents look at this and say, oh, there's going to be a different program director, but I don't think it's really going to be as big of a deal as people. I just don't think it's that big of a deal. I think that the way that we've gone about it is we've really addressed a lot of those transitions.
Well, as you continue to work in your current role, what is your favorite thing about teaching residents?
I enjoy watching residents become doctors. You know, they come in and even as a second-year resident, when they come out here to Port Angeles, they just, and comparing how they interact with patients and what they do in the hospital over the course of that couple of years is actually a pretty amazing process. And you know, I always tell the residents that, well, the residents are always telling me, oh, this is hard, working independently and stuff. I go, oh, it gets really much harder after you get out of residency.
I am quickly learning that right now, and I appreciate you responding to all of my texts about patients I'm seeing. So thank you.
That's what I do. But I mean, just that progression, that's the most rewarding thing. Working with med students and then seeing them come to residency and then stay. I mean, we've gotten to do that. And what I've come to realize too is that our program isn't just a residency. You know, it's a community thing. You know, we have students that come and shadow with us even when they're in high school and especially when they're undergrads. We have med students and, starting as they start med school all the way to sub-Is like yourself,
like me.
that came and did rotations with us, that then went on to do residency, that then went on to work here. And I think that's a really special experience. And so it's been great. It is great.
Will hopefully still be great. So, well, do you have any words of advice for people who are applying into family medicine? What to look for at different programs and what to keep in mind when looking at ours?
You know, I do think that it's hard. We're always telling people like, well, where do you see yourself in X number of years and stuff? And try to imagine that community where you want to be, and then what type of skills you might need to be in that community. It's really common for residents to come early in their career and say they just want to do everything, which I understand. I was like that too. But then to really see what are the things that are important to you. To learn everything in today's world is really, really hard. And it's unfortunately you only get 3 years in residency. And so especially, I guess residents will go do fellowships and so forth, but I think it's this kind of seeing the things that you want to do, and then we will figure out a way to learn those things. It doesn't matter if it's procedure or OB or addiction or diabetic care or there's so many different things, and I actually feel like we can do so much of that training right here in Port Angeles. We have quite an amazing assembly of faculty and resources here. So that's what I think.
I agree.
Yeah.
I do think we have an amazing assortment of faculty and resources. Well, all I can say is, I have benefited from multiple years from training under you and at this facility, and I'm excited to be a colleague and spend more time learning with and under you. So
well, it is it's really wonderful to see you stay, and again, it's just that progression. It's really good, and I just feel Port Angeles is a great place to be. It's a great place to practice. And I won't even talk about the recreational opportunities around here, which I'm kind of famous for.
We can still talk about the recreational opportunities. I do love me a little ski on the ridge.
Backcountry skiing, side country skiing on the ridge, being involved, going for a paddle on the bay. There's great rivers around here. God, there's
And you
just
just participated in the Big Hurt, didn't you?
yeah, I was on one of the old person teams, the Elderberries.
That's a great team name.
Yes, and I was one of the younger people on the team.
Did you kayak?
I kayaked, yeah.
How'd it go?
It was fine. It
Fine.
was great. I didn't tip over.
Oh, that's a win.
I watched a bunch of other people tip over. It was kind of funny.
Was it
No.
really bad weather?
No, I didn't think it was bad, but it was, yeah, definitely. I was paddling along and somebody tipped right over in front of me. It's like, okay.
At that point, you didn't have to, respond to anything as,
there were
as a
others
doctor.
there.
So
It was fine. It was fine. It was good. No, I mean, yeah, there is a lot to do out here, and it's a wonderful place to live.